Is it safe to combine cefuroxime and alcohol? There are no specific warnings against the use of cefuroxime and alcohol, but in some patients the combination may be ill-advised. Patients with a history of high alcohol consumption may want to discuss this when a care provider recommends cefuroxime therapy. The combination can also be a concern in cases where a patient has underlying liver or kidney problems, which may necessitate a dosage adjustment and some lifestyle changes to reduce risks. This drug is an antibiotic in the cephalosporin family, used to treat bacterial infections. People with existing liver and kidney disease can be at risk of complications, especially if they combine cefuroxime with alcohol. The alcohol can overload their livers in combination with the medication and may interfere with metabolism, which could lead to abnormal levels of the drug in the bloodstream. It might become less effective or could rise in concentration and increase the risk of side effects. Some patients experience extreme nausea, vomiting, and intestinal cramping when they combine cefuroxime and alcohol. This tends to be more common when people have a history of alcoholism or heavy drinking. They may need to temporarily stop drinking or cut down on consumption while taking the antibiotic to decrease the chance of experiencing these unpleasant side effects. People with concerns about alcohol consumption may want to bring them up to discuss treatment options. In people who are healthy, with no history of heavy alcohol consumption, there are usually no specific risks with cefuroxime and alcohol. Patients who notice symptoms like nausea, dizziness, or disorientation after combining the two can discuss this with a medical professional. They may be advised to avoid alcohol for the duration of therapy to limit the chance of future interactions. It's also possible that these side effects could be caused by the medication alone, in which case they may continue after the patient stops drinking, indicating that it may be necessary to change to a different antibiotic. Medical professionals may recommend against combining cefuroxime and alcohol from the very start with the goal of preventing complications. This may be based on experience with prior patients or issues in a patient's history that might increase the chance of a bad reaction. People who are not sure about whether the combination is safe can ask for advice and may receive specific information on how many drinks are safe and whether they should avoid hard alcohol while taking the antibiotic.